Good evening. Welcome back to my YouTube video channel. Again, I am going to present another case today. It's really interesting. I'm looking forward to start the case right now. This is the case. The topic is about how to manage space between front teeth on an adult patient. Most of the time when you see a patient like this, what do? You're going to put a veneer on the patient? But typically the general dentist would put veneer on the patient to close the gap. But let's check this out. I didn't do that. So here is the case. Patient came with the 8 and 9 spaced out and already have wear and tear of the enamel because of the deep bite. As you can see, deep bite on the side view here, right and left side view, due to the fact that the fourth incisor is erupted higher than the canine, and due to the fact that the central incisor is erupted more than it's supposed to be. So, and you can see that the occlusal view on the upper, there's space between the number 5, number 6, number 11, and number 12, 8 and 9. On the mandibular, there's evidence of crowding. So when he came to this office, my office, there is bleeding gum everywhere. He's not taking care of himself well, as you can see. So most of the time, what I would do is I start working up the case with the really perio pro, check the gum, x-ray, clean the teeth well, wait for a couple months, evaluate the patient again and see if his ability to clean himself well, or he followed my compliance. So once he agreed to take care of himself, his gum, then there's a promising that we can help him out. So what I do is I start, so like I mentioned to you, I start the deep cleaning, get him hygiene improving. And then I would, when the gum is healthy enough, that's ready to go, we have to do some enamelplasty right away on A and I, and anything that is not having a shape of a tooth, we reshape it again. So that I start like that. And as you can see, several months after treatment, almost more than 16 months, because I want to make sure everything's stable. So teeth really tight and shiny. And I skipped several pictures initially, but this is almost like close to the end, okay? So don't say this is just like one day. It's many months to get to this stage here. And as you can see, the big difference right there. So the next is, so this is again, I just want to show you again, this is before and this is after. There were issues with compliance from bottom here and straight teeth here from where his, on the side view here, from here to here, great improvement. I did not like how I didn't put molar brackets on the second molar. So anyway, as far as the look is great, but as far as the completely balanced, I admit that I miss out the posterior teeth to correct the molar there, but on the mandible, it turned out pretty good. So that's the, this is before. This is before, you guys, the cast, so that really severe deep bite, okay, severe deep bite. And so this is before and this is after. You can see this is before, really bleeding gum and really jagged incisor. Now we smooth it out, we close the gap, and he's taking care of himself, beautifully result. So this is picture from before, after, before, after. and before, after. Patient were very happy. He'd been coming back to me more than 7 years, still really happy with the result. Thank you for watching. This is a very short video. Just want to throw you some information. Of course, there's a lot more detail. I just want to make the video short and simple. If so, at the general dentist, there's so much you can do for patient, not only enameloplasty, deep cleaning, evaluate the patient changeable before you decide to get the either Invisalign in this case or regular braces. Anyway, if you go back, there you can see a lot of root tour that I have to do in order to maximize the upright of the incisor and to improve the aesthetic result. There's no case is considered simple case. Only complicate whether patient compliant or whether it's the other issue, finance or issue with family issue, so many things. So there's no case simple, guys. Every case is challenge. Anyway, I would like to thank you for you guys follow up with me and listen to this presentation. I hope you have a great night. Bye-bye. See you next time, and hope that if you're interested in follow my channel, please feel free to subscribe my channel and have a wonderful night, okay? Thank you.